the psychic aspect. The action of these points is stronger if they are combined with the relevant back transporting points of the corresponding yin organ. For example, bladder 23, bladder 52 for the kidneys. So the points, bladder 43 is the back transporting points for the area between the heart and the diaphragm, which is called Gao Yang. Huang. However, its use can only be understood by referring to the other meaning of Gao Huang in a broader sense, also indicates the site of any disease which is chronic and very difficult, if not possible to treat. This point is therefore used in very chronic diseases, particularly of the lungs, and especially lung yin deficiency. Historically, it was used for tuberculosis of the lungs. Use the back transporting points after using and retaining the needles in the front of the body. We have to retain the body points approximately 20 minutes for the adults, then withdraw them. Ask the patient to turn over and then use the back transporting points. Then leave these points in a shorter time that is no longer than 10 minutes in an adult, whether for tonifying or draining. In order to drain pathogenic factors through these points, use needling to tonify the relevant organs through these points. We use needling to nourish blood and yin and direct moxa cones to tonify qi and yang. For the summary, we have the back transporting points. They are all situated in the bladder channel in the back, one for each internal organ. It also affects the internal organs directly rather than through their channels. They are particularly important to tonify the yin organs, often used to warm the internal organs, and this is for chronic diseases. It affects relevant sense organ like the bladder 18 for the eyes. It is also used for diagnosis. We check for tenderness on pressure. Taken together with the general concept, in diseases of yin, we treat the yang. This quotation suggests that the Back Shu points should primarily be selected in cases of deficiency and cold, which is the yin, and for diseases of the sang, the yin rather than the fu. It is certainly true that the classical indication for these points include many examples of deficiency and cold. For example, we have the bladder 13 for cold lung atrophy, bladder 15 for heart qi deficiency in children, frightened and cautious with heart deficiency, bladder 19 for deficiency taxation, bladder 20 for spleen qi cold, bladder 21 stomach cold and feeble, bladder 23 for kidney deficiency deafness, the 5 taxations and the 7 injuries, taxation of the 5 sang, chronic cold of the water, kidney sang. However, it is equal true that there are numerous classical indications for excess disorders among the back shu points. That is, for example, we have the bladder 13 for the fullness of the chest, difficult breathing on lying down. Bladder 14 for oppression of the chest, pain of the chest, and diaphragm due to accumulation of qi. Bladder 18 for pain and distension of the lateral costal region, hypogastric fullness and pain, fullness of the chest, much anger, mania, depression disorder, epilepsy. In current clinical practice, and as far as we know for a long way back in the historical tradition, back shu points had been selected equally for any patterns of their corresponding sang fu, whether hot or cold, excess or deficient, and indeed had been considered vital points for those purposes. However, it is probably true that most practitioners use the back shu points for the sang more frequently than those of the fu. And this reflects the experience that while the back shu points of the sang are of fundamental importance clinically, the front mu points may be favored for diseases of the fu. Finally, due to their location on the bladder channel, the back shu points, while treating the sang fu, clearly do not treat channel disorders other than those of the bladder channel. They are, however, indicated in some instances for disorders of the sense organ which pertain to the sang fu. Thus, bladder 18 is much used for eye disorders, bladder 23 for ear disorders, bladder 15 for lack of strength in the root of the tongue. Thank you for your attention.